Yes, my name is Robert Polk, and my injuries that I've decided to utilize for my sport, inside track and field, sprinter, is my first one is runner's knee, and in some communities they call it the patella femora pain syndrome. And it's pretty much when you have a lateral deviation of the patella as it tracks in the femoral groove. And usually mechanism that would get this actually started would be tightness of hamstring, the calf, tightness of IT band, patella alta, which is when the patella tendon is longer than the patella. Symptoms usually is tenderness of the lateral facet of the patella and some swelling associated with an irritation of the synovial, a dull ache in the center of the knee, and compression to set patella with elicit pain. Most patient must try to, engage into a strengthening adduction muscles, correcting imbalance between the vasomedialis oblique and the basolateralis through the use of biofeed techniques, stretching exercise for hamstring, the basic quad stretch, wall stretch for the calves. And I wanted to try to show you the McConnell taping technique for the first treatment, and I was going to use my volunteer, Jason. Have a seat, sir. Okay. If you scoot back, sir. Scoot back if I can see your knee on the camera. All right. There for a second, we're going to pull in shorts back and put some, start out with some basic cloth so that we can try best to keep the taping from messing with the skin. I'm just going to tip to the side. So next, the goal is to try best to make sure that patella is center. I'm going to mark the outside, inside of the knee, and then the next tape I'm going to put on is try to bring the patella downward. So I'm going to come across, making sure that that knee is tight. And then the next one, I'm going to try to tilt the patella to keep it straight. And that would be the first treatment I would do for a runner's knee. And then the next exercise I would have him do for the rehab portion I'm going to have come over and do some knee stabilization. All right. Come over here, sir. Put your feet inside the groove. You're going to come up and down 10 times. Come up. 1, 2, 3. And the goal is try to get the patient at least to do this right here, at least 3 to 4 times a week. A set of 10, and then it's going to alternate legs, going real slow. Okay, and you can relax, sir. And next, we're going to do it's called tummy vacuum. You're going to get on all 4. All 4. They're going to try to bring that navel in and relax. And that takes some of the pressure off of the knee, strengthening your transverse abdominals. And come on down, sir. Navel up, bring it in, come back down. You're only going to go to 10, sir. 1, relax. 2, and 3. All right? And relax, sir. And the very last treatment I would like to do will be a standing leg curl. Leg weight. You're just gonna find one, get a water hole and come up real slow. Real slow. One set, it'll be 3 sets of 10, and he's going to hold it 5 seconds and relax it back down. Go back up, sir, again. Maybe 2 more times. And relax. Thank you, sir. And the next injury, you can take those off, sir. Okay. And the next injury is a hamstring. It is the most common injury in the thigh, but the cause is really unknown. One theory is that the short head bicep femoral muscle is subject to highest into the hamstring, and a lot of people say the possible mechanism of injury are muscle fatigue, leg length discrepancy, tight hamstring, improper form, and a lot of times people can injure themselves if they're trying to do a quick turn and they're not paying attention to the mechanics of the body. And a lot of times some symptoms will be discoloration may occur a day or 2 after injury. You have grade 1, most soreness during movement, point of tenderness, and the soreness mild and enhanced most instant tribute to muscle spasms rather than tearing of the tissue. Fewer than 20% of fibers are torn in grade 1 of the strain. Grade 2 is usually a partial tearing of the muscle fiber. It is identified by sudden snap or tear of the muscle, come by severe pain, loss of function during knee flexion. 70% of the fibers are torn in the grade 2. Grade 3, it constitutes a rupturing of the tendon of the musculature, involves major hemorrhaging and disability. 7% of fiber torn, that's severe edema, tenderness, loss of function. And a lot of times the treatment could be rest, ice, cold, elevate. And a lot of studies have showed if they take leave above that would help alleviate it some. Regular activity should be limited until soreness has passed. Range of motion full, grade 1 show. If no soreness, patient begin isotonic curls. Okay, grade 2 rest should be used for 24 hours, 40 hours. Treatment regimen should be ice, ultrasound, and grade 3 it usually lasts 48 to 72 hours. And gentle jogging should have considered it. Okay. All right. The very first thing we're going to do for this physical treatment will be a Romanian deadlift. If you come over here for me, sir, right back over there in line. We're just going to do the deadlift with a dumbbell. So we're going to, instead of doing, start at the bottom and slowly come up. Okay, keep the dumbbells close to you, sir. Okay, we're going to come down and keep your body straight, keep your head straight. Come on back up, sir. All right, give me 10. One more time, sir. Come on back up, okay? Okay, and the next one, thank you, sir, for this one. The next one, we're going to do a one-legged hip thrust. One-legged hip thrust, you're pretty much on the floor. One leg is up. You're just going to go up in the air, okay? This one here helps with the core as well. And bring up your pelvis, sir. And relax. One more time. That's going to be at least one set of 15. He's going to come up, hold it, count 1, 2, 3, 4, 5, and relax. Right? Thank you, sir. And then next we're going to go into some one-legged toe reach. You are reaching. One-legged toe lead for me, sir. One, two, perfect, and relax, sir. Thank you, sir. All right. And the next injury we're gonna talk about is the medial tibia stress syndrome. In other words, it's another name for shin splints. It's usually pain in the anterior part of the shin. It accounts for 10 to 15% of all running injury. 6% conditions called pain in athletes. Mechanism is caused by repetition, micro trauma. Weakness of leg muscles, shoes that provide little support, a cushioning, and running hard surface and overtraining. I normally get shin splints whenever I run due to I'm flat foot, I have flat feet, and I never can pick the right shoes. And they always say grade. They have different grades of it, and it usually occurs before and during and after activity. And treatment, usually if this is diagnosed, you must rule out possible stress fractures via the use of bone scans, X-rays recommended. And a lot of times these things happen because runners are overpronating their feet when they run. And one of the main treatments I was going for is correction of abnormal pronation, then walking, running with shoes, custom fit orthos, and flexibility program for your gastrocnemic soleus should be an arch tape and applied around the area of pain, and one of the treatments we're going to use is cross band walking. And with crossband walking, you're going to take some resistance bands, put it under the arch of your foot, cross the band, put a little tension, keep your back straight, and you're going to walk forward, walk back, walk forward, back. Okay, and you're gonna try it, and the patient has to keep a 45, at least a 45-degree width stance from while he's doing ABD. Here you go, sir. Okay, cross. You're gonna cross them. Okay. You're going to keep a wide stand. You're going to try to keep your back straight, head straight. Come forward. Yes. Go back. Come forward. Keep the tension on it, sir, and go back. Okay. Thank you, sir. All right. And the next... And then the next exercise we're going to do is the anterior tibialis. Okay. This one, we're just going to put some small leg weights around the foot. Okay. We're going to plantar, elevate. Plantar, elevate. Plantar, elevate. And the patient the athlete would do this right here. Down, up, down. Yes. Okay. Yes. Okay. Ever. Okay. And they will hold the stretch for 30 seconds while breathing, and they're going to only repeat this 3 times. 3 times. 3 times. Okay. And the very last exercise we're going to do with this one would be wall squats. We do a medicine ball wall squat. Legs shoulder width apart. Hold the ball close to them. Keep those feet flat. We're going to come down to a small squat and come on back up. Go slowly down, sir. Please don't fall back. Come on back up. One more time. And relax. Thank you, sir. Is there any discomfort, sir? Is that a no, sir? All right. Thank you, sir. All right. Thank you. Let's give a hand for Mr. Crane. Oh, he's been such a good patient. Most of these exercises that we talked about today, most of them would utilize the Rice method, using naproxen, ibuprofen, but hamstring. I personally, when I and even hamstring strain when I was used to run track, I did aquatic therapy. Getting in the pool, getting in the hot tub, let those just go over my hamstring, and I would stretch them out. I do a circumdown motion with my ankle, and I did that every day, and I would try to nail out those muscles, stretch out those muscles, and by the grace of God, everything was good. Thank you so much.